Hello, my name is Thomas Stavropoulos, and I'm the director of the Center on Aging and Health at the University of Regina. We're here to announce today the Innovation in Healthcare Delivery Award that is awarded by the Center on Aging and Health on a regular basis to an individual, group, or organization from the community that is improving the lives of older adults through innovative service delivery or research. Normally, we present the winner or winners of this award during our annual distinguished lecture before a very large audience. Unfortunately, this year, our annual distinguished lecture was canceled due to the precautionary measures taken to prevent the spread of COVID-19. We're optimistic that in the near future, we'll be able to gather once again for these types of events. And we maintain our optimism in light of recent announcements about the the initial success of potential vaccines. The award is adjudicated by an all seniors committee. And this year, the committee consisted of March Thiessen, John Roy, and Kathy Lai. And this exceptional committee of seniors who are also members of the Center on Aging and Health selected Memory Lane at Eden Care. Memory Lane is based on a social model of care with the aim of maximizing the independence of the people who reside there. According to the committee, they chose Memory Lane because of its ability to turn an institution into a home. The objective of Memory Lane is to offer a far more independent living experience than what is typically seen in personal care homes or a special care home. Residents, elders who live in Memory Lane make their own choices about decorating shared living spaces when they wake up. They can contribute to cooking or baking. And do their own housework if they so choose. In other words, they make the same types of decisions that they would normally make in their own home. Memory Lane is connected to the Sapling Early Education Center and provides opportunity for children and residents of Memory Lane to interact on a regular basis and to participate together in various activities. It is our pleasure to congratulate this year's winner, Memory Lane. Congratulations.
As I entered the Eden Care facility, there was such a welcoming experience. As I proceeded down the hallway, I could feel the positivity of the staff as they interacted with the residents that they came in touch with. The small group of residents who are part of Memory Lane literally are like a small village of their own, and with more so just a happy family of their own. There they have their own furnished rooms that they have brought in all their own stuff and have set it up the way that they want it to be. There is even a wonderful dining area that they can meet together, and they can do various things in that area where they can be all together. There's a kitchen that they can help with the meals and baking, and I also so appreciated the opportunity that these people have to be grandparents to the daycare children and interact with them. Memory Lane provides a place for the people living there with a feeling of belonging and being needed.
Okay, like Marge, I was really impressed from the moment I entered into this residence. It was not like residents that, and we have visited several long-term care or elder homes. You weren't met at the door with a staff member who took you into an office and explained the program to you. Then took you through the center, and you could see for yourself. No, instead we were taken through the center first. We were met by a wonderful woman who had a wonderful dog with her, who actually was part of the community. And we went through and we visited the community ourselves. We asked questions of the different participants who were really participating in games with the preschool children and having a wonderful time like grandparents do with their children. Then we went into their living room where we learned that the residents actually participated in the planning and decoration of the room, just like a family would. And they also, their own program, they set their own program when they want to eat, what they want to eat, within a minimum. But, and also when and if they want to do their own laundry. There's not any fixed dates, times, or regulations to follow. And again, as Marge mentioned, their own rooms followed that. They had decorated their rooms. They were nice and sunny and bright. And I think as well as that, the staff at the end, when we were talking to staff with the residents, they obviously participated together. They were welcome. And the staff had a lot of plans for trying to carry this type of long-term residents living out into the community. Again, they were looking for other places where children and seniors could get together in a community where they could go out for walks, etc. It was really wonderful place to be in.
As with the others, when I first walked into Memory Lane, I felt welcome. I didn't feel like I was walking into an institution. I felt the warmth of the staff and began to realize how much involvement the residents had in their own lives. One lady in particular gets up early in the morning, or 3:30 or 4 o'clock, I can't remember which, and goes to help the baker to bake for the day. She enjoys it, and she's allowed to do it. The rooms, planning, everything is done by the residents with the help and or assistance from the staff. It's not an institutional setting in any way, shape, or form. It's just a comfortable, pleasing community in which to live.
Thank you. What an interesting time we live in. What an unprecedented time we live in that we're receiving an award from the University of Regina Center on Aging for health and innovation. To the U of R, thank you so much for what you do for this award, but what you do for elders and what you do in the world of innovation and the use of innovation to improve the lives of elders. We wouldn't be where we are today without your support, without your guidance, and without your academic leadership. Second, to our fellow nominees, you're all great. You all have fabulous programs and fabulous services. Every one of us go to work each day hoping to improve the lives of those that we serve and using innovation to assist us in doing that. So I stand humbled that we were selected to be the nominee this year. Third, to the Ministry of Health and to the SHA for your hope, for your vision, for your support, for your belief in Eden Care communities that we could take and make a program from an existing facility at Memory Lane to provide a home for elders that still had their independence. Fourth, to the Eden Care Communities Care Partner team, in particular the team at Memory Lane. You come to work every day with a vision, with a mission, You put your game face on every day and to serve the elders and the seniors within their homes. You have the privilege of working in their homes. And on a daily basis, you work with the elders and their families to use innovation to improve their lives. And finally, to the residents of Memory Lane and to your families, thank you for your trust. Thank you for taking a program and making it what it is today. Thank you for making Memory Lane your home. Not home-like, but your home. A place that you can live, and a place that you can grow, and a place that you can give as much as you take. Thank you all so much. Memory Lane was born out of recognition that people were living in special care homes that did not need to be there. We were stunting them. They still had a desire and a need and a capability to be independent. Memory Lane allows this. It had a mission to build a home community, to ensure that the people that lived in that home community were safe, they were secure, they would have mobility, they would have interaction, and they would have nutrition. All key factors in the aging process, but more importantly, in combating the plagues of aging, loneliness, helplessness, and boredom. The main benefits of the program are providing a carefree, stress-free lifestyle that our elders and our residents can be themselves, do what they want to do, have the spontaneity in life that is so much required. Memory Lane's culture and philosophy of care supports a space that's theirs. It's their home and a place where they can live independently. Memory Lane provides elders with a sense of purpose, and that is so important to having a life worth living. So to all, be it the U of R, be it to our fellow nominees, to the Ministry of Health, to the SHA, to our care partner team, to our elders and their families, thank you so much. We are so proud to have been the recipients of this year's award for health and innovation from the U of R. Thank you.